A patient comes in and says, "Doc, my brain just isn't working right. I feel depressed. I can't seem to focus, and I have all kinds of low energy." And they thought they needed an antidepressant. And I said, before we prescribe that, let's look at your B12. So where does B12 come from? Well, it comes from animal products. And this patient was also seeing me for a weight loss program, and we were using the ketogenic diet. So he was eating lots of sources that B12 comes from. B12 comes from meat, and it can be the meat from mammals or fish or poultry. Eggs and dairy also have lots of B12. So do people on a ketogenic diet have to worry about being low in B12? The answer is yes, they do. Let's take a little closer look. Those symptoms that the patient presented with are very common when patients' B12 is low. And despite the thought that he had depression, the overlap of having low energy, low focus, and kind of a brain fog are only a few of the symptoms that show up as B12 gets lower and lower inside someone's system. They also have troubles with nerve pain throughout their body. They can get tingling on their fingers and toes. Other problems like just being overly tired and not really having the best immune system are all related to the B12 either being actually low or functionally low. In the world of taking care of the patient, we could just order a B12 shot and make it all better, right? Yes, I could have done that, or I could have tested his B12. But there's some deception in what happens when we're looking at the actual blood test for B12 and whether or not it's functioning inside their cells. Let me show you a little bit more about what happens when you are trying to absorb B12. It's actually pretty complicated. So here's a picture of the human stomach. And as you take on B12, we do it just like anything else. We swallow B12 with an animal protein. That's the first of 3 escorts that this little B12, this essential vitamin, is going to need in order to get into your system and then do its job deep within the cells of your body, giving you energy, making your brain work better, and doing all those other things I talked about a minute ago. The enzymes in your saliva and in the gastric acid will help us separate that animal protein from the B12. And now your gastric acid is actually part of how you make this R protein, the second escort for our star vitamin today. That B12 gets into the first part of the intestines where that R protein will now disappear, and our third escort shows up called intrinsic factor. This one now also binds to our B12 and will travel throughout the intestines till it gets right before the colon, and that's where we absorb B12. So having those 3 escorts and all these parts of the gut need to be functional. So not only do we need these 3 little helpers to get B12 into the system, we need some gastric acid, we need a normal part of the first part of the intestines, we need your pancreas doing its job, and we need the saliva glands doing its job. So that leads me to, well, who is at risk for not having a normal B12? If you don't eat any animal products like vegans, they are actually at very high risk for not having enough B12. Pregnant women need more B12. 40% of the patients who take metformin, which is one of those diabetes medications, are low on B12, as are many patients who do not make acid because I give them a prescription, an antacid. It really decreases that ability for that escort number 2 to do its job. Autoimmune disorders get in the way, as do elderly who have a difficult time absorbing it. Those who have moderate amounts of alcohol also have sometimes normal B12 levels in their blood tests, but the function inside their cells is not happening. Finally, gastric surgery is another place where B12 becomes a nightmare to keep up with. So I tell patients, if somebody's offering you a B12 shot and you wonder, should I take it? My answer is absolutely. Just giving somebody a shot for B12 gives them the opportunity to experience what's it like for a boosted amount of B12. And B12 is water soluble, so you can't overdose on it. So sometimes a shot of B12 is an excellent experiment to say, did you feel better for about the 10 days after that B12 shot? And if you did, that's a time that you should work with your doctor to say, is your B12 really low? The blood test you're going to want to ask for is called methylmalonic acid. You can also check it in your urine. If you want a home test, there's a link in the show notes below to check methylmalonic acid at home. But either way, you and your doctor should work that out, that if this is low, replacing B12 really does improve our minds, our energy, and our immune systems. For those of you that have had gastric bypass and you want to know, can I keto with that? Check out this next video. I'll see you there.